I was born on Ghana land, to whose peoples and elders I pay my respect. And I'm really proud to be back home with my family, serving my community through the Adelaide Primary Health Network. I've been chair of the board of directors of Adelaide PHN for 2 years now. 2021-22 was a year that presented significant challenges for all of us as a community. Battling through the COVID pandemic has profoundly affected each of us, and I know we are all incredibly grateful to our public health, hospital and primary health care services who so magnificently rose to the challenge. Our team's role in the pandemic response was delivered with commitment and determination. Adelaide PHN stepped up to the plate in so many ways, such as onboarding more than 200 general practices to deliver the COVID-19 vaccine and distributing more than 200,000 pieces of protective equipment to local primary health care providers. We also funded the Pharmaceutical Society of Australia and Pharmacy Guild of Australia to provide immunisation training to pharmacies, increasing access to vaccine across our region, as well as expanding support for vaccinating vulnerable populations, including those who are homebound, those with disability, and Aboriginal and Torres Strait Islander peoples. For Adelaide PHN, 2021-22 was also a year of significant change, as we look to position ourselves to best respond to the future needs of primary health care requirements across Adelaide, as well as the wider health system. We were delighted that Michelle McKay joined us as our new CEO. Michelle got quickly to work on reshaping and re-energising the organisation, empowering our staff to do what Adelaide PHN exists to do, helping those in need through the services we commission, by working better to connect services across the local health system and deliver services at the right place and time. Against this backdrop of challenge and change, it has therefore been fantastic to see the impact of what Adelaide PHN has achieved over the year. We have commissioned more services than ever before against our health priorities and based on our needs assessments. In 2021-22, we commissioned 136 contracts across our priority areas. In the area of mental health alone, more than 100,000 service contacts were provided, supporting more than 14,000 clients to access the care they need. Some of the highlights of the important services we have enabled for our community this year include the respiratory and vaccination clinics, increasing access for people with respiratory symptoms to have a face-to-face GP assessment, the priority care centres, continuing to provide community-based care and ease pressure on our emergency departments, and aged care, supporting the interface of the primary health care and aged care systems by improving access to general practitioners and allied health professionals in residential aged care facilities. Engaging our community through our clinical and community advisory bodies and local primary health care providers remains a cornerstone of how Adelaide PHN works. And we are committed to strengthening the impact we can have through even stronger engagement in the future. In fact, many of the exciting opportunities that exist for Adelaide PHN going forward build on the great partnerships we have formed this year. All of this is achieved through our amazing staff, advisory groups and partnerships. I know I genuinely speak on behalf of the board when I say that we are all involved with the Adelaide PHN because we are passionate about what it does for those it serves. We are proud of what we have achieved this year, and we are resolute in our commitment to ensuring a stronger future for the Adelaide PHN and the important role it plays in serving our community.